Medicare Initial Enrollment Updates. What are they? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. In today's video, we're going to answer that question. And why is it important to you? First and foremost, if you're new to our channel, welcome. And don't forget to subscribe, hit the little bell so you get future notifications when we release new videos, which is about twice a month. And don't forget to tell your family and friends or anybody you think that might benefit from this channel. Give us a thumbs up if you like the video. Now, on to today's video. Medicare Initial Enrollment Updates. In 2023, there was a change in effective dates of when you enroll during your initial enrollment period. First and foremost, let's define what is the initial enrollment period before we go any further. IEP. IEP is the 7-month period, 7-month window when somebody is first eligible for Medicare because they're turning age 65. Okay, so if somebody is turning 65, they're eligible for Medicare, and the 7-month window includes their birthday month, 3 months prior and 3 months after. Okay, that's IEP. And there is kind of an IEP for those individuals that are disabled under 65 if they have been receiving Social Security disability benefits for 24 months, they are eligible. And so their 7-month initial enrollment period is the 25th month of receiving Social Security disability benefits, 3 months prior, 3 months after. So, but that's for people under 65. I'm talking about the vast majority of people turning 65 eligible for Medicare for the first time. It's your IEP, initial enrollment period. Before we talk about the change in the rule, let's talk about the way the old rule was, because for many, many years, the old rule worked like this. If my birthday's in April, let's say it's April 4th, and I'm turning 65, my 7-month window is going to be my birthday month, April, 3 months prior, January, February, March, and 3 months after, right? May, June, July. That's my 7-month window. I can sign up for Medicare A and B. Now, if I sign up prior to my birthday month, I can't be effective until my birthday month because I'm eligible for Medicare the first of the month in which I turn 65. That is true for vast majority of people. There is one exception to that. If your birthday falls on the first of the month, any month, you're eligible for Medicare a month prior. So what happens is that 7-month window, if my birthday is April 4th, my 7-month window is January, right? January, February, March, my birthday month, April, May, June, July. So January to July. If my birthday is April 1st, everything shifts back a month. I'm eligible for Medicare the first of the month prior, March 1st. March 1st and then 3 months prior, so December through June. Okay, not to confuse you. Most people have a birthday, that's in the middle of the month. They're eligible the first of the month. Unless your birthday falls on the first of the month, then it's the month prior. Okay, now that we got that straight, if you enroll before your eligibility, let's say you're eligible April 1st, anytime that you enroll from January, February, March, your effective date is going to be April 1st. If my birthday's April 4th and I'm enrolling in the month of April, my birthday was going to be, or my effective date is going to be the first of the month following that birthday month. The old rule said if you enroll after your birthday month, the first month after, the second month after, the third month after, what happened was if you enrolled the first month after, your effective date was the second month after you enrolled. Crazy. So that means if I enroll in May, I'm not eligible to July, the effective date for Medicare. If you enroll the second month after your birthday month, your effective date is the first of the third month after. I know, this is crazy. If you enroll in June, your effective date is September. And the same thing if you enroll the third month, the last of the 7 months, right? The third month after your birthday month. Your effective date for Medicare is first of the third month after you enroll. Phew. I had to write that down because it's very confusing. And a bunch of us in the industry said, this is really dumb. Like, why do you have to wait that long? Why shouldn't it just be the first of the month? And so I belong to an association, National Association of, it's called NABIP, of Benefit and Insurance Professionals. We do a lot of consulting, and we have an advocacy group, and we give guidance to CMS on different things. We have a Medicare committee, and we said, you know, this should be changed. This makes no sense. So in 2023, they changed it. Yay! And so now the new rule is if you sign up the last 3 months after your birthday month, your effective date is not delayed. It is the first in the month following when you enroll. Now that I'm also told, this is one very important thing about this change that you need to know, is that this is an absolute rule. What does that mean? That's the only effective date you can get. So if my birthday's April 4th and I sign up in May, I'm going to get June. If I sign up in June, I'm going to get July. If I sign up in April, I'm going to get May. Why is this an issue? Well, some people are planning to retire, and I've run into people who are actually turning 65 here, but retiring here. And oh, by the way, it's all within their 7-month window. And they want to save money on premiums because they're covered under an employer health plan. And of course, when we get onto Medicare, we have to pay that Part B premium, right? If you want to learn more about that, I did a video on it. But Medicare Part B has a premium. And so a lot of people want to time this, that they're coming off their employer group plan and enrolling in Medicare and a supplement at the same time. Here's the problem. The first thing you have to do before you get a supplement or anything like that is enroll in Medicare A and B. And you have to wait for the confirmation of that enrollment and your Medicare card. That's where you get your Medicare number. They won't give it to you over the phone. That process can take 2 to 4 weeks. And the government, even if your card comes in the mail, if I apply in April for 5/1 coverage, but I don't get my card in the mail until middle of May, I can get a supplemental drug card, but I can't backdate that coverage. So the timing here is the issue. So while they changed the rule, it's good. It is something important to know. It is an absolute. You don't get to choose and say, well, I'm turning 65 in April, but I'm not retiring to June 1st. So I'm going to apply in April, and I'm going to request a June 1st effective date. The government's not going to give it to you. They're saying that you have to apply on 5/1 and get that, and get everything done in 1 month, which is hard to do. The downside is you can, do Medicare only for a month, or you can take Cobra if you have that option. But you definitely want to time your enrollment, and certainly if you're turning 65 and need coverage the day you turn 65 or the month you turn 65, begin your initial enrollment at the start, the first of the 7 months. Do it 3 months prior so that you're not going to have any problems, and you make sure you get your ID card. So the new change that happened in 2023 for the initial enrollment period affects those people in the 7-month window if you're enrolling when you turn 65 in Medicare in the 3 months after your birthday month. If you enroll, you're no longer having to wait 2 to 3 months down the road to get Medicare. Your coverage is going to be effective the first of the month following. So for all of those late Lucy's and Linuses that wait to the last minute to enroll, you no longer have to wait months and months out. So that's a good thing. We hope you enjoyed this video. Feel free to share it with family and friends. Give us the thumbs up. And until next time, this is Kathy Bukowski, the owner of CB Health Insurance. Thanks for watching.